I'd like to talk to you about the PiP, which stands for P in POT, which is a novel device that we've developed for collecting urine from midstream urine analysis. Urinary tract infections are a very common and important cause of illness in our patients and the commonest cause of admission to hospital with sepsis. Collection of the urine needs to be done in a clean fashion for the analysis to be adequate. Currently, we use at least 2 to 3 items of single-use sterile plastic. By introduction of the PiP into the pathway, we manage a number of things. One is to reduce our CO2 imprint by about 80%. We also reduce the amount of plastic we use, removing 2 plastic items, including this 500-metre bowl and a plastic tube. And we also reduce costs by about 70%. It also leads to standardisation of a pathway that is highly under-standardised at the moment. We feel that we've shown also that using the PiP, which is a clean collection device rather than sterile, also leads to significant added advantages in CO2 reduction. And it's made of pulp, which means it's biodegradable or can be put in a macerator and flushed away.
The Infection Prevention and Control team have had the pleasure of working alongside the PiP team to provide expert advice and guidance with the PiP trial. We are delighted to have supported in now standardising the collection of urine across our organisation and are delighted to now have a procedure for all staff to ensure they are confident and competent in collecting a midstream urine. Our colleagues in our wards and departments have also been keen to be involved in the PiP trial and are excited to have worked alongside the University of Exeter to provide evidence that the PiP is a safe way to collect urine. Our teams are engaged as they see the benefit of the reduction of plastic and packaging. Safe storage and handling of the PiP is essential to reduce the risk of contamination. PiPs must never be stored in a sluice. PiPs will be stored and accessed from the top-up room. PiPs must never be removed from the cardboard packaging unless being stored in an approved plastic container with a lid. PiPs must always be stored upside down or on their side. Prior to handling PiPs, healthcare workers must decontaminate their hands.
We explain the process to the patients and gain their consent. We also provide the patient with a private area to produce the urine sample. Before providing the sample, we should ensure that the patient has had a wash and there is no visual contamination of the genital area. Encourage the patient to wash their hands with soap and water before handling the PiP. Patients should be advised when handling the PiP not to touch the funnel part. If possible, it should be held underneath. The funnel part should be kept away from the patient when passing the urine. If able, the patient should void the first stream of 15 to 30 ml of urine into the toilet. And the patient should be advised not to leave the urine in the toilet or the bathroom area when they are done with the sample. The PiP should be handed over to a healthcare professional once the sample has been collected. The healthcare colleague should clean hands and don a non-sterile gloves prior to handling urine. If a urine dipstick is required, this can be performed. A urine dipstick is not required for all patients, so please follow your local guidance. Pour away any excess urine using the white pouring spout area of the PiP. Place the 10 ml red top boric acid urine collection tube onto the funnel and decant the urine into the tube. Place the red top lid onto the tube. Pour remaining urine into the sluice upper and, if available, place the PiP into the macerator. Remove gloves and decontaminate hands. Label the urine collection tube. Place in a specimen bag, sealed securely, and sent to the lab. Record in the patient's note that a sample has been collected and sent to the lab, and document any dipstick result if taken.